Michigan Psychological Care, Director of Corporate Development, Lara Hakamaki. Lara, welcome back to JTV.
Thank you.
Happy New Year.
Happy New Year.
Last time we talked, you were busting at the seams over there on Fern off of Wildwood, and I understand you're on your way to solving that space problem.
We definitely are. So we are expanding, which means we'll be moving from 437 Fern Avenue over to 2532 Spring Arbor Road, right over by all of those dental offices, lots of tax offices. So we'll be right near all of your pre-existing physicians. That being said, we're not getting rid of our old office on Fern Avenue. We're moving ABA in there. So that is autism and ABA. That's bringing kiddos with autism ages typically 2 to 21, sometimes up to the age of 25, to their neurotypical levels of their peers. And we should see that this coming year, as well as a psychiatric nurse to manage medication for all of the companies.
Awesome. Well, I'm glad you're having such great success in Jackson. Obviously, you're meeting a need. And this time of year, we've just gone through the holidays. It's the time of year when there's not much sunlight. People get seasonal affective disorder. I think you talked about that last time. And January blues.
Yep.
Any suggestions on improving our mental health during the post-holiday period?
Yeah, absolutely. So there's the whole new year, new me, New Year's resolutions, and what a better way to kick that off than coming and working on your mental health. So let's say you want to lose a couple pounds, or you want to do something that you loved and haven't been getting to. The best way to really get to all of those goals is to focus on your mental health. When you feel good internally, you can feel good externally, and you can have more energy and be happier with the life you're living.
So many people will have a New Year's resolution that has to do with their physical health. Lose weight, start working out, things like that. But if you've got challenges with your mental health, some of that stuff is just never going to happen.
Right, it can be very difficult. For some people, especially, let's say, depression. It can keep you in bed for a full day, multiple days, weeks, months. And so if your New Year's resolution was to lose weight, but you can't really get out of your head enough to get into the gym or go outside and take a walk, it's a struggle to lose that weight. So going to therapy and seeing some of our counselors would definitely help with that.
Are there some simple things that people can do? Again, the comparisons between physical health. If you want to lose weight, you just maybe cut down on your eating or start moving more. But if you make a decision that I am going to improve my mental health, are there some steps to do that, to get there?
Definitely. So there are things that you can do inside of and outside of therapy. So getting outside, getting some sunshine, even during the colder months, getting one of those happy boxes, the light boxes that mimic daylight. And then also in therapy, there's different kinds of therapy that can help with certain things. So CBT, DBT, EMDR, and that's something that you would bring up when you're calling our front office and saying, hey, this is what I'm experiencing, what could I use? They're gonna go through, pick the best therapist for you and the different methods that may work for your mental health.
And your approach, you want to help people with therapy, you don't want to have to give them prescriptions.
So prescriptions can be great in some instances. In some, people are not interested in it. We want to bring a psychiatric nurse to our company, so those who need help managing their medication, whether that be increasing, decreasing doses, getting medication, or getting off of medication. We can combine that with our therapeutic services and really get them to live the life they've always dreamed.
And I think so many, and I think about years ago when my kids were teenagers, they had a lot of friends that were diagnosed with attention deficit disorder or ADHD, and the cure or the fix was just pills. It was just like so many of my kids' friends, they were on prescriptions. For somebody that's been their only exposure to treatment of mental health, is it a big shift to start working with your therapist?
So let's say, for example, ADHD like you chose, we are able to do the psychological evaluations in our office. So we can tell you yes or no, you do or do not have ADHD. Then you'll come into our office and you'll see one of our therapists for therapy or counseling. And it's not that big of a shift. It really is consistency, which helps with mental health, and you can talk through all the things going on in your head that you may not want to talk about with somebody outside of our practice.
Now, I know Lara's not a therapist, but you are an expert on mental health because Lara's been in the Miss Michigan program, Miss Michigan USA, and that's your platform, isn't it? Mental health awareness.
It is, yes. So I ran last year in 2022, and I'm running again this year, and both times my platform has been mental health awareness. It is something so near and dear to my heart. I've seen friends experience mental health struggles, family experience mental health struggles, and it is important for me to bring those services and something for people to really find help when they need it. Oftentimes we see younger adults, younger kids dying by suicide, and that can be prevented if we really give them the resources that they need to live the life they've always wanted to.
Yeah, and unfortunately we've seen in the last couple of years several well-known people who have died by suicide, and each time you see mental health professionals and even reporting media give resource information every time a story like that comes up. And it's really becoming more aware that there are resources available.
Absolutely, and that's why I want to use it as my platform for the Miss Michigan pageant. Because if you think about pageants, you think beautiful young women who have everything they could ever want and never experience mental health struggles, because how could you be pretty and successful and struggle with your mental health? But that's not the case, and I want to provide that service for anyone and everyone.
So you just said it, what I was thinking. So you probably don't need any New Year's resolutions. You're perfect.
I am not perfect, that's for sure. I actually am working on myself in many different ways. Physical, mental health, actually just doing things that I care about that I've kind of let go. And I think that's important for people to recognize. And one of the ways to recognize those things is really going in to see somebody who can look outside of your life and say, hey, let's work on this.
What got you interested in mental health as a platform? Did you experience issues, or do you have family or friends that had struggles?
Yes, absolutely. So growing up, when you're younger, you don't really recognize these types of things unless you've been through something pretty significant. Then, middle school, high school hits, and hormones, you experience anxiety and depression, and you see your friends and family experiencing that. And then actually running in the pageant, I used this quote that I had created for the pageant specifically, and they said, why is mental health your platform? Why is working at Michigan Psychological Care your dream job? And I said, because everyone experiences mental health struggles at some point. It could be a grocery store clerk, it could be a Fortune 500 CEO, it could be Miss USA. And Miss USA had died by suicide in 2019 or 2020. So it really hit them that yes, it could be anyone.
So if you have a physical issue, it's easy to call and say, hey, I think my arm's broken. I think it's harder for people to make that phone call when they're dealing with some sort of a depression or mental health or something that they're not really comfortable they've never gone to a professional about it. How do you make that first step? How do you make the phone call easier for someone in the first appointment?
Absolutely. So there's a couple different ways that we do it. Typically when they get referred from a physician, the physician sends us their information and we contact them. So we take the anxiety of giving a call to somebody right out of their hands. And we say, hey, we're here for you. What can we do? Let's get you set up. And we help them choose the best therapist for them. Now let's say they do need to call us and they have anxiety over it. They feel comfort in knowing that we have a fully staffed front desk at every office who knows our therapist so well that we can fit you with the perfect person for you.
And I know there are some mental health issues that make it very difficult for people to even get out of their house. Do you offer telehealth or Zoom or sessions like that?
Absolutely. We see in person and telemedicine, no wait list, and we also are able to take basically every insurance you can think of. We have interns who can take those without insurance, and we really do everything that we possibly can to provide services to those in need.
Awesome. So you mentioned there are doctor referrals, but is that necessary?
No.
You just call?
Yeah, absolutely. If you find that you are looking for a therapist, you don't need to be referred. You can call in and say, this is what I'm experiencing. Who do I need to see? And we'll get you set up for a psychological evaluation or therapy with the perfect therapist for you.
Awesome. Well, we wish you the best as you prepare to move. March, April?
Somewhere in that little time period, let's say somewhere around April we'll be moving, and then shortly after that we'll be looking at bringing autism and ABA care to our old office, and we'll have a shiny brand new office for us to enjoy. Great.
Well, thanks for being here today, and thanks for offering all your services to Jackson. Glad to have you as a new community member.
Thank you.
Thanks for being here. From Michigan, Psychological Care Director of Corporate Development, Lara Hakamaki. Next,